All right, welcome everyone to the Fall Winter 2022 Hilltop Institute Educator Discussion Series. We are in our last month of this season, which is a little hard to believe. We've made it to December, and for those of you in the Seattle area, it's been a bit of a cold and snowy one. So I hope that you've had a safe week and that you're somewhere warm and safe today to participate in our workshop today. I am so excited to welcome Diana Kwon as our special presenter today to talk to you about cognitive behavior therapy for young children. Diana Kwon is a clinical psychologist graduate student at the University of Washington. She relocated to the Pacific Northwest after receiving her BS in integrative neuroscience with a concentration in cognition in 2015 from Fordham College at Rose Hill in New York City. Diana's research focuses on the design, development, testing, and dissemination of health interventions for addictive behaviors in marginalized populations that have a high reach and are cost effective. So welcome, Diana. Welcome to all of you on this Saturday morning. Just a couple of housekeeping things. I see some folks are just coming in, so I'm going to post that chat or sign-in sheet again. No worries, I will post it again. At least twice more in our time today. A couple of housekeeping items. If you are able to, we would love for you to keep your video on so we can see you and connect through facial expressions in this virtual space. We totally understand if that's not possible for you today. Please make sure that your mute is on just so we don't have any audio interruptions during Diane's presentation. And please utilize the chat for questions, comments, aha moments. We really want you to utilize that space to connect and to really be engaging in the material today. And before we begin, or I should say we will begin as we always do, with a land acknowledgement. Wherever you're calling in from today, we have several folks calling in from Seattle. We also have folks calling in from out of state. We even have one participant calling in from England today. But we are all sitting on stolen lands. And here in the Pacific Northwest, we are on the land of the Coast Salish people. And Diana is going to give us our land acknowledgement today. And as she does so, I'm going to be dropping some resources in the chat for all of you. As opportunities to continue your own learning as an individual, to think about how you can engage in the work of restorative Indigenous justice on a collective level as well. So as I pass the mic over to Diana, we'll go ahead and drop those resources in the chat. Welcome, Diana.
Thank you. All right, let me just get this up for everybody. All right, so thank you so much for that introduction. And yes, I do want to start with a land acknowledgement. So I know we have several people here from Seattle and the Washington area. I think they're also maybe either watching the recording or here live with us just across the US and across the world. So I do encourage you, just like Becky said, to think about where you're at and look at those resources that she's going to drop into the chat. So again, I want to acknowledge a land that I personally am on right now. I'm located in Seattle, Washington. It's the unceded ancestral homeland of the Coast Salish peoples. And this is land that also touches the shared waters of all tribes and all bands within the Duwamish, Suquamish, Tulalip, Nisqually, and Muckleshoot nations. I really want to also emphasize here that in my own learning and my commitment to moving forward and what I can do, given that this is unceded land, I want to recognize that as the original stewards of this land, they understood and still understand the interconnectedness of all things and maintained harmony with nature for millennia, for a really long time. And I want to honor that. I want to honor these Indigenous peoples, their knowledge, their commitment to Mother Earth, and also commit myself and continuing commitment to learning from them. I also want to say, at least in here in Washington alone, there are at least 25 tribes alone, if not more, I think closer to 29. So I really encourage you to learn about where you are currently at and what lands you are on. Okay, anything else, Becky, before I dive in?
I think we are all good. Thank you for that land acknowledgement, Diana. And yeah, we're ready to dive in.
Awesome. I will do my best to monitor chat, and with the screen full, I see some people and it's a little bit hard to look at chat. So I know that Becky will also stop me at times if questions come up. So we are going to talk about cognitive behavioral therapy for children. Again, my name is Diana. I use she, her pronouns. My goodness, there is so much under the CBT umbrella. And so we will not be touching on everything today. And when I was thinking through what would be helpful given kind of the audience, I tried to pull pieces that will be helpful in your day-to-day, and also when you're thinking about if you need to refer to like a higher level of care if something's going on, for example, trauma, and what can you do. And so with that in mind, I do want to start quickly with some introductions. I actually might stop sharing in a second just so I can see chat a bit better. But I'd love for you to drop in chat or just unmute. I'm pretty informal. What is one thing about your job that really fills your cup? Like, what are you passionate about when it comes to your job, and specifically really like working with kids and teens? So I can start and I can say I take a life kind of span perspective, meaning while at UW, I'm technically an adult track student. I see both kids, teens, and adults because I like to see how the whole system works, and also see them from when they're younger all the way till, adulthood. And so for me, it's seeing their growth, seeing them be able to find who they are, what they're passionate about, being able to find their way and find their voice. And I think that's something that really, when I think about hard days and getting up in the morning, that's something that definitely keeps me going when I think about this work, and makes me really happy about that. So I'm gonna pull up chat here so I can see. All right. I'm seeing from Jenny, working with children gives you so much hope for the future. Absolutely. It's really fulfilling because you're helping our society move forward. Absolutely, in a positive way. I definitely hear that. Is it Leah or Leah? I apologize if I'm pronouncing that wrong. Providing nature-based education for birth to 3. That's
Lee.
awesome. Is it Lee? You said?
Lee, yeah.
Got it. Thank you for the correction. I appreciate that. Seeing accomplishments, absolutely. Connecting with the whole system, kids, families, absolutely. Looking at, just so many great things popping up into chat. Yeah, seeing them succeed, and like when they've struggled and seeing how all that hard work pays off. Absolutely. When they respond to the past learning with new learning. Yes, and we will be talking about that a bit today too. Absolutely. And feel free to keep adding that in. I do have another question. What is one thing, because the work that we all do, no matter what space you're in, it can be tough and it can be hard, and there are definitely tough days. What is one thing that you do to take care of yourself so that you can be there for the kids and teens, and also for yourself? And again, I will start hiking. My big thing is going out into nature and being in nature and connecting with nature. And so I'm currently nursing a back injury, and I'm very much looking forward to going back out and like snowshoeing. So I'd love to hear what you do to help you recharge. I'm seeing more about like what makes it really special to do this work. Yeah, taking off when you're sick. Absolutely, having that space, and hopefully you have people who support that. Yeah, learn through play. Yeah, absolutely. Just seeing them be able to grow, kind of going back to the first question. Workout time, absolutely, whatever that looks like for you. Exercise, spin classes. I'm also a fan, again, nursing a back injury, but I love spin classes and yoga. Alone time, absolutely. Connecting with yourself. Sometimes when if you're around kids, teens all day in some capacity, or even parents, it's nice to just pause and take that break. Sleep. I love seeing that, at least 8 hours unplugged from social media. Absolutely. I'm seeing a lot of great things of what you're doing to take care of yourself, which is, I want to just, why I started with this question before we really dive into CBT. No matter what you're doing, no matter what tools you're pulling from, it's so important to remind yourself, why am I here? Why is this work important to me? And what am I getting up in the morning for? And also, how do I take care of myself? Because if I'm not taking care of myself, how are we modeling then for the kids and teens to take care of themselves, like their selves, and being able to advocate for themselves? So thank you for sharing that. Okay. And feel free to keep adding in the chat too. So our path for today, I'm not really one to say agenda. I think when I say agenda, it's like, oh gosh, I have to do homework or something. So our path for today, we're going to do a super quick overview of CBT. I have started a timer to try and keep us on track because we are going to take a break in about an hour, but we'll start with this overview of CBT. I also want to bring in then a large chunk of the first part will be how to increase communication and compliance with kids and teens, mostly with kids, younger kids, while also decreasing burnout and overwhelm. This was designed, what we're going to talk about, PCIT, was designed for parent-child interactions. However, adapting it for, whether you're a principal, whether you're a teacher, whether you are, working and going to homes and helping parents in that way, whatever the capacity or whatever your job is, kind of adapting it in that way. And then we'll probably take a break there. And then for the latter part of the day, and we'll do an activity with that one, we will focus a little bit on trauma and how you can support kids or teens who have experienced trauma. Because my goodness, sadly and unfortunately, it has always been there, and I think it's coming to light a little bit more, but then we've also had the pandemic and all sorts of things. And so how do we help kids who are going through really tough situations? And then benefits of restructuring and modeling. And then we'll wrap up and see if there's time for questions. And I'll also give you my contact info if you have more questions. All right. If I go too fast, please tell me. I just want so much to talk about, so much to get to. Okay, so a quick overview of CBT. I'm really curious. I'm just going to pull up participants. Anyone, you can respond with the Zoom function of just like either a thumbs up or like a raise your hand. Who has like used CBT before, heard of CBT? Yes or no? There's some, okay. Seeing a couple of thumbs up. All right. Got it. All right. Well, I am interested to see how this maps on with your experiences of CBT. But CBT, really what we're talking about here is that we have this cognitive triangle. We have thoughts, we have feelings, and we have behaviors. I think it's important to note that feelings are not just emotion words. It also describes your physical sensations that go along with that too. Because I think especially when we think culturally, some people may be more inclined and more adept at describing like the physical sensations and not necessarily labeling the emotions, and vice versa. Some might be really good at describing the emotion word, but not necessarily identifying what's happening in their body. So I think that's an important caveat to put there. With CBT, I think a lot of people think, well, cognitive behavior therapy, it's mostly about the C. It's mostly about the thoughts. And while yes, there are parts of cognitive behavioral therapy that focus on the thoughts, we are actually going to take more of an approach where we're looking at all of it together. So CBT really says that we can have thoughts that then lead us to having certain emotions. Oftentimes we're thinking about negative emotions, but it can bring up positive emotions as well and positive sensations. And this may lead us to have behaviors, whether they be kind of more ineffective, unhelpful behaviors or neutral or more helpful behaviors. There's also, because you see these are all bidirectional, we could have feelings come up and we might not necessarily know. So maybe like a car comes by and you're walking the street and you have to jump back. And that's like pretty automatic. And you have this feeling of fear. That might come first and kind of almost concurrently with your behavior of jumping back to protect yourself. And then you later have the thought of, oh my gosh, that was really scary. And so there's also this piece of we could have feelings and these feelings lead to our thoughts and behaviors. And then it's not really a triangle, it's really a circle. We also can have these behaviors, which then will kind of perpetuate the circle or the cycle or change whatever we're about to do or think or feel. So the thought with CBT as well, if we're seeing kids or ourselves doing things that are not helpful, that are not getting us to where we want to go, that might be a bit disruptive and maybe not helpful for them to achieve what they want to achieve, how can we help them with that? Well, we can work on changing their thoughts, because if we change our thoughts, then the feelings that are associated with that, and then later on the behaviors we want to do, that will change. Or we could also try to change our feelings about a situation. And that can also help with the thoughts and behaviors. Something that I think people don't often think about with CBT that we're going to be talking about today too, is we can also change the behaviors. We can work on shaping behaviors into a way that are more helpful, showing them what is going to be really helpful for them to get them to their goals, to get them to a life that's really helpful for them, whether they be little kids to if they're teens. And that in changing the behaviors and teaching them new behaviors can also help with the thoughts and the feelings as well. So big takeaway here is for today, we're not only just going to be talking about the C, we're going to be talking about the C, the B, and also emotions, which unfortunately doesn't get necessarily put into that acronym. Questions on that piece? I'm going to pull up chat real quick and see if there's any questions before I dive into an example. And feel free also to just unmute. That's also fine by me.
Diana, there was a question about slides going out afterwards.
Yeah.
Are you comfortable with me emailing these slides out to attendees?
Absolutely, definitely.
Thank you.
Okay, I will keep going, but definitely, another point, feel free to stop me. Okay, so the first thing that we are going to talk about is really, I wanted to find a way to help people in various different capacities in what they do, increase like communication and compliance with kids and teens in terms of behaviors, something that'll help them while also decreasing burnout for yourself. So what came to mind for me is a type of therapy within CBT that's called parent-child interaction therapy. I also read through, Becky sent me some of the questions that people had. This incorporates a type of play therapy because I saw there were some questions about play therapy. So PCIT, because we just love our acronyms, it's an evidence-based CBT treatment. And the goal essentially is to help caregivers or those who are in an education system, because it can be adapted in that way, in a kind of an administrative role, but like working with kids and teens, but mostly kids for this one, and young children, when they're like experiencing types of behaviors, social kind of things that are getting in the way, like difficulties, maybe high emotion, dysregulation, that type of stuff. And really it's to improve the quality, first and foremost, of the parent-child relationship, but it really can be also within a group setting, within a teacher setting, within classroom and all those types of settings. And so the theoretical basis, like the influences that were used to create this, it draws from a bunch of different theories. So we got social learning theory, we have attachment theory, developmental, behavioral principles, and then of course the traditional play therapy. So it's really taking a lot of these really great theories and coming together to figure out how can we help kids who might be dysregulated, who might be, things like temper tantrums, maybe there's some defiance, like refusing to follow directions, could be like physical or verbal aggression. This has also been helpful with like destruction of toys or even family belongings. If there's like if you feel like there's whining or crying and you don't understand what's the reason, it can help you understand what's happening there too. It can help with hyperactivity, short attention spans, those types of things. And so we'll dive in a little bit more to the structure here. So PCIT has kind of two parts to it, and you must master the first part before you go on to the second part, really. I promise I'm not going to talk at you for the whole day. We're going to get to an activity for this, but child-directed interaction is the first part, CDI, because we just love, again, acronyms. The big goal here for this first part is it is led by the child. We are not, as caregivers, providers, we are not the ones who are kind of driving the conversation, the play, whatever's going on. It is about the child leading this. And really why it was developed this way was to enhance the parent-child or other type of relationship by really like increasing positive communication, attention, and imitation. And I'm going to really dive into more components. I'm going to break both of these down more so, but that's the overarching kind of idea of CDI. Once you've mastered that piece, then you can move on to what we call parent-directed interaction, or in your case, it could be different in terms of what your role is. So PDI. PDI really is to help the parent or the caregiver, the provider, foster this like supportive home environment by giving them skills to be consistent, to be predictable, and to follow through with behavior management skills. Because we can imagine, and I'll dive more into this, if you're giving them different directives, but they're not consistent, I mean, that we're confused as adults when we don't get consistent, directions. So you can imagine if it's a child 2 to 7 years old, that's really challenging. They're not going to know what's actually going on. So I'm going to dive into each one of these to give you a bit more information. So starting with the child-directed interaction, big golden rule here, like I said, you follow the child's lead. This is not where you are giving directive. This is not where you are telling them what to do. You are listening to the child and you are encouraging them to lead you in play, lead you in whatever activity they are doing. And there are skills within this type of CBT for the caregiver to use to help foster that. I want to dive into those skills, but I want to talk about the benefits really specifically of CDI first. What we've seen through research is that it increases these feelings of security, of safety, of attachment with the caregiver, with the provider, whoever it is, because you're listening, you're showing them like, hey, I'm interested in what you're doing. It also increases their attention span. You can imagine when, adults are looking at their phone, doing multiple different things, they're telling the kid then what to do. Like kids like, I want to play, like I want to draw right now. And like, oh, why don't we actually do this other thing? Well, this kid's not going to really want to pay attention for that long then, because that's not necessarily what they want to do. It also increases, we see, their self-esteem, which I think especially now, I mean, I know there's some kids, like hopefully you're on social media at 2 years old, but like it's baked in there as you're growing up that self-esteem we just see is tanking right now. And we want to help increase self-esteem. So it increases self-esteem. It also increases what we call like pro-social behaviors, sharing, taking turns, cleaning up, like helping a friend, those types of things. It also, what we see when you do more of this child-directed interaction, it decreases like the frequency, the severity, and even the length, essentially, of tantrums. Because if you can imagine, you're actually letting the child lead, you're letting them have that autonomy and that choice of what's going on in terms of the play. It also decreases hyperactivity and decreases kind of those like other behaviors that might not be so helpful in getting them what they want. Maybe they're being a little bossy, or maybe there's some snarky sassiness coming in there that might not necessarily might be funny, and at times might, in some contexts, might not be the most helpful. And big thing here for you all, it decreases the caregiver's frustration. It decreases whoever's working with them, your frustration, which frustration leads to burnout really quickly. Questions on that piece before I dive into like, how do you do this? Like, how can you actually do child-directed interactions? I don't think I see anything in chat yet. Okay. Keep going. So in terms of then the pride skills, these are the skills that you can use to help you actually do child-directed interaction, because I'm show of hands oops, let me go back. I'm trying to pull up the participant list. There we go. All right, show of like hands with the Zoom room. Who does this? Like who was like, this is so easy. Like I know exactly how to do this. I do this all the time. This is definitely my go-to when I'm working with these kids. I see a hand. I see, okay, wait, Jenny, do you mind saying a little bit more? Like tell me a little bit more about this.
Yeah, so I work with infants. And so a lot of my work, like with these, as I'm looking over these pride skills, it's like all I do with them. It's we're really like just watching what they do, being present with them, making lots of eye contact, kind of like narrating through what they're doing, celebrating when they're struggling and trying new things, and lots and lots of imitate, just all of these things.
Yeah.
It just sounds like what I do every day. So
Jenny, I'm curious if you're willing, also
yeah.
you do not have to share. Have you noticed like what has been helpful about that in your work, and what maybe has been like challenging also when doing that? And Caitlin, I see you. I'm definitely gonna come to you next.
Yeah. I think it is especially helpful in like building relationships with infants and fostering that connection. You can really tell, you can see children like relax more and open up more when you are kind of like narrating what they're doing, guessing at their emotions, kind of describing what they might be experiencing.
Yeah.
A challenge that makes sense is that the children are nonverbal, so
Sure.
it is sometimes supposing and guessing. So as the adult in the situation, you never want to like disrespect that relationship by leading them away that maybe they're not trying to go. So sometimes it is, kind of providing these words that they might be experiencing, but you hope that you're kind of guessing it right or getting something that resonates with them, since they can't really tell you what's happening for them. So
Yeah.
that is a challenge, I guess.
Yes, absolutely. Especially for those who are working with those who are nonverbal, it gets a little bit easier when they start to develop their, verbal skills, if that's possible. And yes, and it's part of it could be a little bit of a guessing piece, and also it's trial, it's practice, needing to practice this and seeing like what sticks and what doesn't. And no two children are going to be the same. We might see patterns, but given context, given history, there may be different ways that kids respond to this. Caitlin. Oh, I'm not sure. I think I see you on mute, but I haven't heard anything yet, unless I'm
Hi, this is Tony Washington.
Hi. And then Caitlin, just I just think your audio's not working, so maybe check audio and then I'll come back to you, Caitlin. But yeah, Tony, go for it.
Hi, I'm just looking at the pride skills, and I know that I do this in my classroom often, regularly, most all day. Definitely praising children and labeling on what they're doing, if it's coming to circle time, if it's raising a quiet hand, if it's are you comfortable during the read aloud time? I don't really request that they sit crisscross applesauce. I just ask them to make sure that they're comfortable. Describe their behavior. If they're sitting just the right way, you might say, I like the way, you look ready, or I can see you are really thinking about that question. I see you have something you want to say. And then of course, just enjoying them by smiling
Fun.
and having fun and laughing. And I was one that said, I really like it when they share their past learning and the new learning. I'm just so excited because it tells me whatever we did, it works, it's working, and to keep doing that because you want to keep building their knowledge. And so that's really exciting for me. And just being able to reflect, on what they say and share it out loud. I heard you say, do you want to add on to that?
Yeah.
So yeah.
Exactly. And really it's, what both you and I think Jen, you're getting at in different ways because different ages that you're working with. I'm making an assumption there, but I'm assuming with coming to circle time, they're going to be a little bit older than
I work with children preschool age 3 to 5.
Yes. And so even though there's different ages, there's ways that you can show I'm interested. I care about what you're saying. I care about what you're doing, and I want to be a part of it. So I know, Caitlin, you have your hand still up. I'm going to see. Okay, mic is busted. I want to see, Caitlin. Do you think it's working now?
Yeah, I'm good.
Oh, awesome. Yes, go for it.
Okay. So I woke up not too long ago, so I'm not at my most coherent. But a lot of my first early childhood training comes from the Jumpstart program that they used to have in New York, which I'm not sure if people here would be familiar with it, but basically it's college students. You are going into a classroom, usually with a lower income preschool, and you're assigned children who are showing delays, generally in literacy skills, but it can be in a lot of different things. And so we are specifically trained on a lot of these. We were specifically trained on a lot of these skills, on how to praise, on how to talk about their behavior. And now I am working in a kindergarten after school class, and I specifically have I have a few children who are showing delays, but there is one in particularly who has been diagnosed. They're pretty severe aggression and behavior issues, and using a lot of these techniques, like she'll take a lot of breaks from the classroom. And sometimes when we go, like, she'll start asking me to act out certain scenarios, today, yesterday, she was a fairy and I was trying to take her wings. And so kind of working through that play, working through the scenarios that she was creating, and never saying no, but then also trying to adjust it to show skills. Eventually I said please, and she gave me new wings, and I was just like, oh look, and now my need has been addressed.
Yeah.
So yeah, I'm using these skills constantly every day with these kids. Imitation, using mirroring, guessing at their motivations and why they are showing certain undesirable behaviors in the classroom. Commenting on their successes. And it has I've been with her for 3 months and there's still a lot of progress to be made. But also like I've seen her come so far, and it has particularly helped in creating social success for her.
Yeah.
Because that has been a big motivator.
Yeah, absolutely. And so what I love also hearing from all of these examples is, and I'm going to dive in for those who might not be as familiar with like pride skills or these types of skills, I'm going to dive in and give more examples. But what we can see here is for many different demographics, different cultural backgrounds, maybe different factors, contextual factors, diagnoses too. It can be really helpful because at the heart of this, what are we doing? We're showing the kid that we're interested. We're showing that what they're saying, what they're doing matters. It's interesting and I want to learn more and I want to hear from you more. And we're not doing other things at the same time. And so it's really building and fostering that relationship is at the heart of this, like the child directed interaction piece. So really quickly, when we talk about pride skills, when we say praise, we mean labeled praise. Labeled praise is much more, it's very different than just general praise. So you could say something like, oh, that's great. What's great? The kid might not know what that is. So that's not labeled praise. Labeled praise is like, thank you for picking up those blocks. Thank you for giving my fairy wings, in that other example, great manners, like such a good job sharing your toys. So it's being more specific so the kid understands, what am I actually doing well? What are you praising me for? I also want to say praise can be hard at times culturally. Depending on your background, I know for my own background, praise is hard to hear because that's not something that is typically given out pretty freely. And that's just because of the cultural context that I come from. And so you may have kids who might be uncomfortable with that. So finding ways, I call it like hot versus cold, and cold not in a bad way, but how can you label praise for those who maybe are really receptive to super hot warm? So like, oh my gosh, such a great job doing whatever. And then for the ones who maybe that might be too much and it might be overwhelming, it's kind of cooling off a bit and say, great job on X, versus like really coming in with like even expressions and, your voice intonation, like the tone of your voice is kind of cooling off a little bit for those that maybe that's a little bit more uncomfortable. Labeled praise really increases, first off, the likelihood that what you want to be done is going to happen again. And it helps them like build up their self-esteem. Hey, I did this thing. That's awesome. Like I did something really well. That was great. And it makes both caregiver and child feel really good. I would also say, do not just use this with children. It can be used with coworkers, bosses. It can be used with your partner and family members. It's beyond just working with kids. Reflection here is really about phrases or statements that are made by the caregiver that have the same meaning as whatever the child said. And so this might be a little bit harder, like for example, those working with infants, and there are ways that you can do this like kind of more behaviorally versus verbally. But they can be a direct echo, like a repeat of what the kid said, or it can be like, you can take it a little bit farther or paraphrase it a little bit to maybe see, like, is there a hypothesis you have of like what's maybe going on here, or do you know a little bit more about the kid? So a direct echo, like a imitation, could be like the kid says, hey, this is my friend's name is Charlie, and you just say back, your friend's name is Charlie. That's a direct echo. That's a direct response. Another one that might be that you take it a little bit further and maybe this kid a bit more. Kid says, oh, I really like pizza. And like your response back to them is like, you do like pizza with lots of cheese and pepperoni, because you know a little bit more about the kid. You could say something more like, maybe the kid said, I'm really frustrated, or I'm having a really tough day. You can say, yeah, this day, I can see this day is really tough. And I know, you told me you didn't get much sleep last night. And just like opening it up a little bit more to your hearing, and a little bit more of the context. Reflections are really important because, again, it shows the kid you're actively listening to them, you're focusing on them versus all the other tabs that might be open in your brain at the time. It shows the kid that they're important. What they're saying, what they're doing matters. It's important. That is so important for us to foster, and really important. Something that we really focus on in CBT, it's important what they're doing. And it also helps increase communication. So you echoing back or paraphrasing back things helps them see, ooh, what I said mattered. And so they're actually going to possibly speak more. They're going to use their language skills more, or help develop them if you're working like with infants. The next one for imitation here, imitation really is this behavior where you observe and then you replicate, essentially. You imitate, you kind of mirror what they're doing. So some examples could be, maybe you are playing with a bunch of like cars and trucks on the floor, some Legos on the floor, and maybe the kid is like pushing the Legos like, or pushing the car like on top of the Legos. And you would do the same thing. It really is just mirroring what they're doing, because it shows them, hey, they're watching me. They think what I'm doing is interesting. They're engaged. It opens them more up to you, to wanting to talk with you and wanting to be open with you. It also it lets the child then lead what the play is, versus you going in and saying, oh, let's make the building blocks here, or let's, I'm going to make this picture. I'm going to draw a smiley face or a picture of a tree. You wait, you hold back, you see what are they doing, and then you imitate them. Oh, they're drawing a picture of a bee. I'm going to join them. I'm going to also draw a picture of a bee. It also makes it super fun for the kid, because they're like, wow, you like what I'm doing. That's awesome. For describe, this is another one that I think is actually, people like, oh, I get it. You're describing their behavior, and it can be hard to describe without judgment. We are so conditioned in our society, I feel like, day in and day out through media and all sorts of things, to add layers of judgment to what a person is doing. When I say judgment, it doesn't necessarily mean good or it doesn't necessarily mean bad. It could be also a positive judgment too. Judgments are fragile. Even positive judgments can be fragile. And so what we're trying to do here is just be behaviorally descriptive of what they're doing. So we are verbalizing, we're using phrases to talk about what they're doing. So maybe you watch the kid, they're starting to build a fence of like Legos. So you literally say to them, they didn't say that to you, you're just watching them, and you say, you're building a fence with Legos. Maybe there's like animals to keep the animals safe. Something like that. You're describing what they're doing. Maybe again, going back to the car and pushing the car up like the Lego ramp, it could be you're pushing your car up the ramp. Describing without judgment. Instead, you're not saying you're doing a really great job at pushing your car up the ramp, or you have a really cool car and you're pushing it up the ramp. We're keeping it non-judgmental. We're keeping it pretty just, what are the facts? Again, this helps lead the child in play. And it lets the child focus more on what they're doing. We've seen in research, it actually increases their attention span and helps them focus than that putting the car up the ramp. And again, it also lets them know you're paying attention to them. I'll do the last one, and then I think there's a couple of things in chats before we move on to the parent part or the caregiver part. Enjoyment. I think, Tony, you said it. Have fun, enjoy it. Like, be in that moment with them. In people who get to work with kids, I am so grateful that I get to be a child myself at times, that I can have fun, let go. With my teens is a little different for this one. With my teens, maybe I can be a little bit more sassy with them if that's kind of more receptive to them in a way that's effective. But it's a state of just taking pleasure, having fun, because what we see then is the kid can see, are they actually enjoying this? They know if you're like, okay, I'm doing this thing, versus, oh my gosh, this is so fun, I'm doing this thing with you. You're doing this, I'm going to do this. That's way different, and you'll have a way different reaction and vulnerability then opening up, as opposed to, okay, this is all right. How much more time do we have left? That type of thing. Really showing your radical genuineness, essentially here. It increases warmth. It increases also their self-esteem, we've seen through research, and it makes it just more entertaining and memorable for them. Okay, I want to pause and look at chat. All right, is labeled praise also known as encouragement? Just seeing the responses here. So labeled praise is not necessarily encouragement. Sometimes with encouragement, it gets to me, it reminds me a little bit more of like reassurance, versus labeled praise is much more direct. Encouragement can be vague. Whereas labeled praise is, I am telling you in this moment directly, you did a nice job with your manners. You did an awesome job putting the blocks away. So it's not necessarily like you are inadvertently encouraging them to do it again, because you're reinforcing that behavior, but you're not necessarily encouraging them to, in that moment, put those blocks away. That's vaguer. Instead of saying, hey, they did the thing, you're not yet telling them what to do. They did the thing, you're praising it specifically. Yes, describing absolutely can be hard, especially when they're engaged in art activity. yes, I love what you're saying, Maria. They will correct you. This also offers feedback. You could say something and they're like, I'm not drawing a bee, I'm drawing a flower. You got some corrective feedback. That's okay. Okay, then I'm going to draw a flower with you. You know, it's not the end of the world if you get it wrong. They will give you, you know, the correct information typically, or you're building up that trust to get to the point where they'll give you that feedback. All right, keeping an eye on time, I do want to get to our activity. I'm going to just talk about, this is where so there's definitely a role for you all in that, absolutely. And here's a parent directed kind of interaction where we can adapt it a bit to be more for educators, for people who are just, you know, working with kids in general. So primary goal here of this kind of parent directed or caregiver directed interaction piece is to change ineffective caregiver child interaction patterns. So this is focusing on, what am I possibly doing that's ineffective, that's confusing the child, that is not necessarily helpful. And so the benefits, what we see here of this kind of caregiver directed interaction is you're seeing increased compliance with whatever, maybe it's another teacher, or maybe it's the principal, or maybe it's their older sibling who's taking care of them. You see increased compliance with what things need to be done. We also see increased confidence for you all. It definitely, we've seen through research, increases people's confidence. And it also decreases your sense of overwhelm. I'm going to get to that a little bit more of like the history behind PCIT in a bit, but definitely increases confidence, decreases stress. It also improves behavior at home and in public. So what you're doing in your setting can then help kind of translate and generalize out to the home, out to if they're on a sports team or whatever they're doing, aftercare, that kind of thing. Just like with CDI, we see decreased frequency and severity and like length of aggressive behavior, and decreased frequency of destructive behavior, destroying toys, destroying things at home, that kind of stuff. And so really the goal here is for caregivers to be consistent, to be predictable, and to follow through with behavior management skills, which I'll talk about a bit more here. Big thing though, before you go to this, before you start giving directives, you must be able to do the CDI piece first. You have to build that trust. You have to build that bridge before they're going to listen to you and do things that you're asking them to do. So for this part, you learn how to deliver clear, super direct kind of commands, which I know sounds like I feel like it's like a hefty word, but it's just essentially things that you want them to do and utilize it in like behavior management skills in a really effective, helpful way. To do this, how do you actually do this? There are kind of what we have these 8 guidelines. So first, you have direct commands, which again feels like a weighty, hefty word here. Essentially what we're saying is be really clear. Do not be vague here. I mean, can you imagine, like, if you do, have you ever had a boss or a friend ask you to do something and you left it, be like, I don't know what I'm supposed to do? I know I've been in that. I've seen some nods. Yeah, it's challenging. So you can imagine for a kid who maybe doesn't have as much language capability or doesn't know some of the like wording, like the what are you actually asking them? It's very confusing. So we really want direct kind of directives that are very straightforward. So for example, a direct command could be like, it's time to clean up. Please put your plate in the dishwasher. So instead of saying it's time to clean up, well, what are we cleaning up? There's the dishes, we have the toys. What are you asking me to do? So it's time to clean up. Please put your plate in the dishwasher. It could be, it's time to leave for school, or for those who are in the school setting, maybe it's time to leave for the bus, or it's time to go to recess, or it's time to come in from recess. Please put your shoes on, or please take your coats off. Please hang your coats up. Really being specific about what you're asking. Indirect kind of requests are like, can you put the plate in the dishwasher? Now that might seem like it's direct because you're saying, well, you're telling them to put in the dishwasher. You're asking though. What we're saying here is we're taking away the asking, we're taking away the suggesting, and we're saying, tell them what to do. Give them the thing that they're supposed to do and do not ask for it. So another example that would be indirect would be like, I want you to put your shoes on. Well, if I was a kid, I don't want to put my shoes on and you didn't ask me to do it, so I might not necessarily put my shoes on. I don't want to do my homework, so I'm not necessarily going to do my homework here. You said I want to. I want you to. You're suggesting. And then another example could be like, let's pick up the toys, let's pick up the blocks, like that type of thing. When you're giving these types of kind of directives, you're suggesting that you want them to do something, but the command then applies that the caregiver is going to help. So instead of saying, let's pick up the books, if they need to do something because you need to do something else, you tell them, it's time to come in, put your coat on the hooks, whatever the case may be. So that is direct commands. Now going to positively stated. So positively stated are, we just want to make sure that the directives you're giving are in a positive manner, meaning that they should tell the child what to do rather not what to do. We want what to do, not what not to do. So examples of positively stated commands here are, please use your inside voice, or please walk next to me, or please come up to my desk so we can talk. Please come to my office, whatever it is. Indirect commands would be like, stop yelling, stop doing this, don't jump on the bed, don't, throw paper at your friends, that type of stuff. Because what we see in research is when we give people the option of things to do, they're much more likely to do the behavior than things when we tell them to stop. Because it's like, well, what do you want me to do? You're telling me all these things I can't do. Well, what are the things that I can do? So instead of even focusing on that, you're focusing on what do you want them to actually do. Sometimes it's important to note here that like when you're telling a child they're doing something wrong, it can come across again as critical or negative. So we're then like taking away the whole points we're building up in like the CBI part of building up that self-esteem. We're totally breaking that down, be like, don't do this, don't do that. Well, if I heard that over and over again, or even a couple of times, I feel like, well, am I doing anything right? And so really focusing on positively stated. The next thing is like being mindful, one at a time. It is saying, do not give multiple part commands. Okay, who has had a boss or friend, partner, or whatever, give you like 5 things to do in one statement? I have. Have you been able to remember everything that they said? No, I was not. I would have to write it down because I wouldn't be able to remember it. So you can imagine, again, a kid, if you give them 2, 3, 4 part commands, it's going to be difficult for them to follow. And so things like, please put your shoes on, please work on this like homework set if you have it in front of them. Please watch this video I'm showing in class, versus like, go grab your shoes, put on your coat, go wait for me by the door, and I'm going to be there in 5 minutes and we're going to head to the bus. My brain would be like, wait, what do you want me to do? Where are we? Bus, I'm going to the bus, but what else do I have to do? Especially again, thinking like 2 to 7-year-olds. So again, trying to make sure if you have multi-part things that you want done, break it up. We see that across the board when we have behaviors, if we ask them to do things in adults, children, teens, in small, manageable, bite-sized pieces, you're much more likely to get higher compliance and likelihood in the future of them doing those things. You're chipping away. You're not giving them a whole list. Okay, I know I'm talking a lot at you, and we're going to get to an activity after I get through these other ones, but specific. So make sure, again, you're specific. You're not doing things that are vague. This kind of goes back to like the direct commands as well. So an example would be like, please sit quietly in your chair. Please keep your hands to yourself. Maybe kids are kind of like, now they're throwing things at each other, or like whatever, they get fidgety. Like it totally makes sense also because like school can be long. Please keep your toys on the table. Versus, what are some examples that you can think of that could be a vague command? You can feel free to like put them in chat or unmute. What could be like a vague command? Or ask of again, command feels so weighty, but ask of a kid. Please settle down. What do you mean? What is settle down? I don't know what settle down means. Can I still be like fidgeting with my hands, but you want me to sit? Like, I don't know what you want me to do here. Absolutely. What are some other examples of vague commands or vague things that you've asked that's too loud? Yeah, what's too loud? What do you mean too loud? Like what is loud? Like, what do you want me to actually do? Absolutely. Some other examples, oh yeah, please get ready. Get ready for what? Please listen. What do you want me to listen to? Exactly. Some other ones are behave. I've got from Becky, settle down, act your age. Who has heard that one before from even their own parents or something? Act your age. What does that mean? The no thank you. Yes. What does no thank you mean? No, but thank you. I don't know what you're thanking me for. And it's absolutely, you can again imagine kids who don't have like full verbal capacity yet. What are you asking me to do? Okay, so developmentally appropriate. This is just making sure like, who's your audience? I'm sure Jenny, your ask or what you're going to be doing is going to be quite different than maybe Tony, given the age differences. And then also, I think it was, I believe, Caitlin, when you have those who are developmentally delayed or have disabilities, that's going to also be different. Knowing your audience. So examples could be like, in general, okay, please hand me the blue block, or please hand me the red block, versus like, please hand me the aqua cylinder. What like 5-year-old is gonna know what an aqua, maybe, but probably not. It can also be something like, saying something like, please come talk to me, and just leaving it at that, versus going on and on about, please come talk to me as an adult. We need to discuss your behaviors. We need to talk about why this is inappropriate and all that. Totally over their heads with that. The next one is tone of voice. So this one, you really want to be typically delivering this in a neutral, calm tone, because we don't want to act like we're yelling at them, like they've done something wrong. And at the same time, being too soft spoken they might not hear you. I also saw Tony the cleanup. Yep, exactly. Also vague. But they might not hear you, for one. Maybe they couldn't hear you because it's too soft, but also it's not showing that this is something that, it's not delivering it in a way that shows, hey, this is something that actually does need to get done. This is something I want you to do. So you can do things in a calm way. That's like, please give me your backpack. Please come talk to me, during lunch break, those types of things, versus if you say in an unpleasant or really loud way, like, oh, give me your backpack. Like, come on, like, get over here right now. Like, let's hurry it up. Those types of things I wouldn't want to respond to that. I don't really feel so great when I hear things like that. So keeping it in a calm tone, which this goes back to the first question I was asking earlier, what do you do to make sure you are rested, to make sure you are taking care of you? It is so easy to fall. You might see these, like, I would never talk like that. It is so easy when we don't sleep, when we haven't taken care of ourselves, when we have 20 kids, or, even 5 who are being so loud and things just aren't going your way that day, to have a harsh tone. And so it really goes back to, how are you taking care of yourself? What are you doing to make sure you are rested, you are able to be there fully present? Okay, also explanation or research. This is really important too, because I think oftentimes, especially this even goes beyond kids, but goes to teens, we tell people to do things and we don't tell them why. And so not understanding the reason or the rationale behind it, just because they're a kid, that's not fair. They can understand those things. They can understand, hey, it's time for bed, so I need to pick up my toys, versus it's time for bed, go to bed, or pick up your toys. Well, why? Like, what's the reason right now that I have to pick up my toys? Why do I need to go to bed right now? Well, it's 10 p.m. and you need to get some sleep so that you're well rested, you can play with your friends tomorrow, be there at school. So again, other examples like could be, it's cold outside, please put your coat on, versus put your coat on, that type of thing. The last one here is only when necessary. So this is when we do not want to lose the power or kind of the hold that these commands or like asking for things, the directives can have. So if a child is given too many things to do during the day or even the night, the child can then really become frustrated and angry. You're asking a lot of them. Let's remember, they're kids. And so you're about to, like, necessary things that could be an example of, you're about to fall off the monkey bars, please come sit next to me. Please hold with both hands. Those are scissors, or maybe like adult scissors, because I know there's like child versions. Please hand them to me. Please put them down. That type of thing. Versus not so necessary things to be like, the TV remote's over there, like, please give it to me so I can watch my favorite show. That would be more at home, but like, it could also be something like, oh, my coffee cup's over there on the bookshelf, please go grab it for me. That's not necessary. And so you're getting them to a point where I'm like, oh, why am I actually doing this? This isn't necessary. So you really want to be specific about what you're choosing. Really think about what you're choosing in terms of what you're asking them. I'm going to just talk really quickly about a couple other things, then I'll take questions, and then we'll do a practice. There are cultural and contextual factors here. So I think I kind of hinted at this before a little bit. there are some cultures where because PCIT and what we just talked about, a lot of it is focusing on the positive, what you want them to do and labeling what's going well versus focusing on the negative. We're really trying not to do that because first off, you got enough on your plate. You don't need to think about two things. But two, we've seen in research, focusing on the negative can actually not like have negative impacts, can actually get the more of the undesirable behaviors. And so I do recognize though, my own culture, that it's focusing on the negative is really, it's common. It's like, don't do this thing, like, you know, don't do like this, like you don't have good grades in X, Y, and Z, don't you know, do that again. It's just common. And so it's going to be harder for those in those types of cultures to adapt to this. And I'm thinking also when, first off, having kids from different cultures, cultural backgrounds, but also if you're working with parents and giving them suggestions too, this could be harder. And so really, I think the rationale here and what to tell people, because it makes sense, you know, when you look at history and all of that, like why cultures come up with specific things and why they do things the way they do things. And what we can say is from research, if we focus on the positive, more of like what they've done well and asking them to do things versus not do things, we just get more of a shift. We see that we get more of what we want. And it's not saying that what you're doing is wrong. It's just saying that this thing might be helpful in getting you to where you want to go a bit quicker. Another piece here is PCIT was originally developed, and there's thoughts about that. It was originally developed and also like to help parents specifically reduce recidivism. So it was the reason why this came about, it was used commonly for those who have maltreated their kids. And so really trying to up compliance with parents versus getting overwhelmed. However, it is now used in many different situations. It's not just used for that. However, I can imagine that some of you may have parents who either corporal punishment because of culture is something that is accepted. I mean, we know in the state of Washington that technically it actually is legal as long as you do not leave a mark. So, you know, but what we can do is tell people, hey, from the research, what we've seen is not using those types of things and instead focusing on like positive reinforcement, labeling praise directively and like labeling what you like what you like them to do. That actually gets them to where they want to go more and reduces the possibility of developing depression, anxiety, and other behavioral problems down the road. So two pieces here. One, it was developed with those types of kind of populations, not necessarily the cultural aspect, but populations where maybe those types of behaviors are more common for teaching kids. And at the same time, we can also recognize that those are common in cultures, different cultures. And we know that that's not necessarily really helpful in getting the kid to do what you want them to do. And so when you present this to teachers, or when, you know, kids want a rationale, you can tell them, like, we see doing this actually can be more helpful. I do it. It helps me do things in a way that's more helpful for me. So again, it was used for the reduction of recidivism, and we've seen it now in research been applied to many different scenarios. Okay. I want to keep an eye on time a little bit. I know we start a little bit later, so I want to take questions and then we'll do a practice, I think, and then we'll take a break. Any questions? I'm looking at, okay, clean up now. Questions about this before we do a practice? And then Becky, I think we'll do groups of two. I'm not sure how many people we actually have. 13 groups of 2 for the most part, unless there might be a group of 3. Any questions about this? Okay. I want a show of hands. Who would like to take a break first and then practice? That's option 1, so put it in the chat. Option 1 is take break first and then practice. The practice will be about 10 minutes total. Or practice now and then take a break. That's option 2. So put it in the chat what you'd like to do. I want to see what the group wants. So option 1 again is now I've gotten them confused. Option 1 is doing the practice and then break. Option 2 is break, then practice. People feel like they need to break first? Okay. All right, let's take a 5-minute break then, and then we'll come back. So come back at 11:36, at least PST time, so 5 minutes. Thanks. And I'll be here if you have questions. Appreciate that. So Recidivism, which is, I feel like, a mouthful at times, and I typically jump over the word. Essentially, it's the likelihood that somebody would re-offend. Like typically it's used for those who are somebody who is in jail. And so usually it's referring to the likelihood that that person will offend again. However, when used in a context like this, it's for those who maybe for parents who have used corporal punishment in the past, or maybe got really super dysregulated and unfortunately used, again, corporal punishment, verbal kind of punishment in a really aggressive way. And so it's trying to, when it was originally created, it was to reduce that rate of parents doing that again. Typically, what we've seen actually when it was created was used with families who had like CPS involved, those types of things. Great question. Any other questions before we do a practice? Who here has done role plays before? Yeah. Okay, I'm guessing probably quite a few of you. I don't think I will ever, I've been doing role plays for over 5 years now, and I think I will never get over the possible anxiety that might come up when doing a role play. And what I'm about to ask you to do is you'll get into groups of 2 or 3. You are for 5 minutes. One of you will be a child, and you can let your partner know what age you are. And you're going to do CDI. So you're going to have one of them pretend to be a child, and you will follow them and play and use those pride skills we talked about. And then at 5 minutes, I'll kind of send a blast to the group. You're going to switch. Because of timing, we're not going to have time to do both, like both people do CDI and both do the PDI. You're going to switch, and then the person who was being like the adult, the caregiver, will now be the child, and the other person will now do PDI. So more of that directive, using directives and using those kind of 8 guidelines we talked about, being specific, not vague, positively stated, those types of things to ask them to do something. Questions on that? Okay, so let's do breakout rooms for 10 minutes, and I'll send a blast out to everyone, and I'll try to hop around. But 5 minutes to start with, CDI, then switch, and then you'll do PDI for 5 minutes.
Great.
Thanks, Becky.
Yeah, you bet. And sending those breakout room invitations now. Everyone can go ahead and jump in.
Now that we are all coming back. Okay, so really quick before we move on to the next section, thoughts, reactions, what might have been challenging, what seemed more natural, what did you learn from it? Just curious about thoughts. And yes, role plays are challenging, especially when you might be playing a kid. Yes, Rachel, I see your hand.
Yeah, I would say our group did really well with the techniques and things like that. And something we did notice, and something I brought up too, was in general, going through the pandemic and coming back out of it. I work with 2.5 to 5-year-olds, and a lot of these children were born, just before the pandemic and didn't have a lot of social time. So we all notice that in general, children are struggling with that interaction with their peers, and they have there's a lot of battles, physical battles for things, and using words is a challenge because some of that was, everybody was masked, and just that language development is a bit delayed. So there's been a big lift this year, I think, with everybody coming back together. Our school was open. I'm sure everybody's schools, but through the pandemic we worked, but we had a much smaller group. Mm-hmm. And now we're back up to the regular numbers, and having that interaction with their peers has been very challenging. I say overall is the most work that we're seeing,
Yeah. Absolutely. And so I'm really glad you brought that up. And something actually we talked in the group that I was in, I think Melody brought it up. That is challenging. It's going to be a battle. It's going to be a lot of work, and things within the CDI, giving them the language, when you see them doing things that labeled praise, will be really helpful within those social interactions. So you can even be a part of a group and label praise, and you can mimic what they're doing if it's something that's desirable. Really show them, like, let them lead you, so that they're also, and then label it, use descriptive words so that they start to get the language that they unfortunately were not getting. because of the pandemic. And is it going to change overnight? Unfortunately, no. It's going to take a little bit. But yeah, getting that so kids, the thing also too is humans in general are, I am sad that people have to be so resilient. And at the same time, we are resilient, even kids. And so they can pick up on things quite quickly. And so being able to just start to try and have a little bit of that in, even 5 to 10 minutes each day in the classroom, can definitely help in the long run. Yeah, thank you, Rachel. Any other thoughts, reactions? Oh yeah, running to go to unclear commands like can you, will you? So yeah, we are so programmed. I was just telling the group I was in, I live with my sister and I am programmed to be like, can you do this thing? Versus like, she's not going to do it if I ask her to do it in that way. Much more directive though. She will probably be more inclined to do the dishes. Now this is also if I take out the trash can, but that's different because this is me and my sister. But can you is a really, I feel like something that we need to be more mindful of when we're asking for things. Okay, I want to keep an eye on time, so I'm going to jump us back into the PowerPoint presentation. There we go. Okay, we already had our break. I'm just going to move you all up this way. Okay, so now what we're going to talk about a little bit more is trauma and how to support kids and teens who have experienced trauma, because like I said earlier, sadly, unfortunately, it has always been here, and we've also seen an uptick given the pandemic, given people being home more, maybe home wasn't actually a safe place. And so we're seeing more kids and teens who have experienced trauma. So I want to back up and say there's so many things I could tell you about what we could do with kids with trauma. And what I'm going to present to you is a type of therapy that I would highly suggest, and I'm going to ask you all questions soon and work with Becky on this. I'd love to know where you're from because I'm going to send out a resource list of people who are in your area, or at least like maybe telehealth, even beyond Washington, who can do what I'm about to talk about, which is TFCBT, which I'm guessing some of you are familiar with. Because I want to know where you are and be able to provide those direct resources if possible. Trauma is something that if you're able to, getting a higher level of care is really, really important. And we've seen a lot of progress with something called TFCBT, trauma-focused cognitive behavioral therapy. This is not something that I'm recommending you all dive in and do. This is something that you have to be trained in to do. And there are ways though, and I'll tell you about it, where we can take the parenting part of what people learn through TFCBT and how you can add it into your classroom or one-on-one settings with kids who have gone through things that are traumatic. I also was looking through the questions. Becky gave me some of the questions. So at the end of this kind of module about trauma, I'm going to answer a couple questions that came up about, and just this is a sensitive subject, but about sexual assault and then assault in general, and how you work with kids if you're starting to see, you either know that happened or you're starting to see them like play out that what happened with other kids. So I'm going to answer those questions at the end of this piece. So first off, I would highly recommend, like I said, trauma-focused cognitive behavioral therapy. We love our acronyms, TFCBT. This is a really evidence-based kind of joint child and parent or caregiver psychotherapy for children and adolescents. So we see typically it's like they say 3 to 17, but we've actually seen through research that you can actually do 3 to 18-year-olds. And what I really like about TFCBT is it's been researched, not just, we typically see researches in white Western populations. This has been researched across a variety of cultures, a variety of backgrounds, low SES, different races and ethnicities, different even religious cultures. And we've seen that it actually is helpful in various different backgrounds, contextual factors. And so that's what I also really like about this, because I think elephant in the room, there's a lot of these types of therapies that have only been researched in white Western populations and not across the board. But this is why I like TFCBT. So really it's for those who are experiencing like clinically significant, like emotional behavioral difficulties. So these are things like skipping school, anger outbursts, maybe there's some destructive behaviors, more impulsive behaviors. This is not sleeping. This is like, maybe they get really upset, could be like really sad or really angry out of nowhere, or when they're reminded of something that happened. Maybe they were physically abused by their parents and they see someone pushing a kid on the playground, and that could be very cueing to them to then start to have memories come up about it, or just get really physically and emotionally distressed. typically what I also like about TFCBT is you're not in therapy forever, because one, I understand costs, and two, what kid really wants to be in, maybe there's some who want to be in therapy for a really long time, but probably they don't want to do this after school or before school or during their lunch break. But usually brief, 12 to 20 sessions. It's what we call a stepped care model, meaning there's two parts to it. There's the prac and the TIS, as I like to say. Everyone who does TFCBT will get the prac, and I'll tell you more about what that means. Not everyone will get the second half, the TIS. This is where those who maybe need a higher level, even higher level of care, more in-depth kind of trauma treatment, they will go on to that second part. And again, I'll break down all of these different, what does prac, what does TIS mean? So this is where I would love, either in chat, but also I know we have this information, I think, Becky, of like where people are. I'd love to hear where you're located, like the general area in Washington, outside of Washington, just so and we even have people who are trained in TFCBT across the country, across the globe. So, for example, with everything going on in Ukraine, we actually recently sent a bunch of people over to Ukraine to teach people how to do TFCBT, so that they can deliver it there. And we had experts coming not just from the US, from Poland, from Germany, from all different areas to kind of go there to help with that. So even if you're outside the US, I'd love to hear where you're from so that I can try and curate a list for you all. So a little bit more about goals of TFCBT. So again, it's to help the child and supportive caregiver. Now, there might be a situation, and I've had clients in the past where they don't want parents involved. And in Washington, and 13 and over, you're in charge of your own mental health. You're an adult, technically. So we could, if it's an abusive situation, we've had it where I've only done it with the kid and not involve parents. We're luckily in a situation where we're able to do that without charging, like that type of thing, using community resources. So it works really well when you have a caregiver support who can be a part of this. It doesn't have to be parent. Maybe they don't have parents. Maybe, parents are not able to do this. It could be an older sibling. It could be aunt. It could be grandma, somebody who is a part of their life that is a supportive person in their life. So the goals here are first to teach them, both child and caregiver, effective coping skills for when facing like these trauma-related emotional and behavioral problems. This is like we talked about avoidance. Maybe they're not doing their homework. They're not going to school. They're not hanging out with friends. Could be anger outbursts. It could be like you're seeing detachment. Maybe they used to hang out with friends. They used to be so vibrant. They're with their enmeshed in their class. And then you're starting to see them just really be on their own. They don't want to hang out with people. Maybe they quit, like they played soccer or they did an aftercare program and now they really just don't want to be a part of it. It could be about like negative views of the self, like I am the problem. What happened to me is my fault, or I deserved. That's a common one. I deserve what happened. It also could be about the world itself. The world's really scary. It's not a safe place, that type of stuff. So this is really to help them cope with those types of symptoms. And it's to help them face and resolve any problems that are stemming from this in a safe and therapeutic way. What we want to do here, a goal of CBT or TFCBT, is to integrate their trauma experiences and help them move on. So a big part about trauma work for TFCBT might sound counterintuitive. We might want to say, oh, well, let's forget about it because that's really scary. And so we don't want them to think about it. Well, okay. Don't think about a pink elephant over my head right now. What are you probably thinking about over my head? I'm guessing I'm just probably a pink elephant or something over my head right now. The same principles apply. They went through something traumatic. Some people will recover on their own, natural kind of recover, and some don't. And then they constantly are trying to push it away. Well, it's like that beach ball or the pink elephant. You push it down under the water. At some point, it's going to pop. And it's not going to be in a way that's going to be very helpful. It's going to be those outbursts, the detachment. So what we want to do is actually have them face it. We're going to have them face what they went through and help them move on in a way that's safe, in a way that, is positive, not saying, oh, what you went through made you stronger. No, we're not doing that stuff. We're saying it does suck what you went through. And how can we move forward? How can we still help you go back to soccer? How can we help you be part of class a little bit more? How can we help you feel safe going home? If home is safe, that type of thing. I'll go through the structure and then I will pause because I'm going to dive into like how you all can use the parenting skills in your own environments. So there's the prac and there's the TIS. PRAC, because again, we love our acronyms. The P stands for psychoeducation and parenting skills. So this is giving not only parents, because I think sometimes people think, oh, parents and caregivers just get the education. No, no, no. Kids get it too. They want to hear, they want to know, like, why am I having these symptoms? Like, I went through this thing and now I'm going through all this like really like crummy stuff. What's happening? And they can handle it depending on their age, like, you know, their capability. They can handle what you're saying to them, and it'll help them understand, well, why am I doing what I'm doing? It goes back to when you're doing the parent-child interaction of give them the rationale, help them understand. Also the parenting skills. Parents are a part of the system. Caregivers are part of the system. You all are part of the system. Teaching them ways to be able to help them cope too. So that's the P. We also talk about relaxation in TFCBT. So mindfulness, I feel like, has gotten a lot bigger now, which I love. I am a huge component of mindfulness. And if we could spend another 2 hours, I would talk your ear off about it. We talk about relaxation because you can imagine when kids have gone through something traumatic, they're heightened, right? Their cortisol levels are up. They're just like, they're fight or flight or freeze. Like, they're ready to go. They're ready to protect themselves, or they're just like, I'm totally frozen and I'm detached. And so we want to teach them, how can they relax? How can we face things that might seem scary but are actually safe in a way that and use relaxation skills so that you can be able to face this thing without feeling I'm at 100 out of 100 on my emotions. So like breathing techniques, ways to kind of like use your whole body to relax, like a full body kind of like checking in on my toes and, you know, squeezing my toes and squeezing my like calves and those types of things, and going through your whole body to help you actually relax. Affective identification regulation, big words, I feel like sometimes, for what are your emotions? Let's identify what emotions are coming up for you, and how then can we use skills to regulate. You're really intense, like you're 100 out of 100 right now. You're like so heightened on your emotion. Okay, what skills can we use right now to help you bring that down? Maybe it's distraction. Maybe it's like, you know, I'm going to go play a game right now just to distract myself for a little bit. Maybe it's I'm going to have something that's really soothing, like my favorite ice cream or something, or I'm going to cozy up in a blanket. How can we help you regulate? And then the last one for PRAC is the cognitive coping. So this I'm going to get a little bit more into after we actually talk about trauma, but this is where we're talking about more of the restructuring. So restructuring really is about taking thoughts that are not helpful, that are maybe leading to heightened emotion, like heightened negative emotion, or leading to behaviors then that are not helpful, like it's my fault that what happened. I deserved it because I'm a bad person. Or the world is scary and I can't trust anyone. It's saying, let's take that apart, find the truth, and also find where there might be some other interpretations here so that we can help them change their thoughts, so that then these emotions and the behaviors will also change as well. So that's PRAC. What therapists will do, will go through PRAC. This is not necessarily 4 sessions. It can span a couple, like 8 sessions even. They'll go through this and then they'll reevaluate. Did kid improve? Did teen improve? Are they coping better? If they are, they will either refer them out to maybe coaching for ADHD, or maybe there's a little bit more work on depression specifically outside of trauma that they want to work on, or maybe kid's fine and that's it, they graduate. For those though where, you know, and this is typically when we've seen multiple traumas or something that's pretty intense, you move on to TIS if they're not ready. So back to our acronym, the T stands for trauma narration and processing. So what they're going to do in trauma narration and processing is, from the age of 3 all the way up to 18, the therapist finds various ways to help them understand and talk about what actually happened and create actually a narrative. So for those who are 3 years old to 5 years old, it might not necessarily be I'm writing out the whole thing because they can't do that. It's them using play therapy, like we talked about with the PCIT, more of that like kind of imitation and labeled praise and that type of thing, to let the kid draw out what happened, or act out with, you know, dolls or something, what happened to them, so that they can help them write down what happened and process that and say, you know, this is where you're also bringing the cognitive coping piece of like, well, you know, this person hurt me because I deserved it. Well, what does that mean? How can we say like, oh, well, actually, that person is an adult and that person did something that you did not ask for and you did not consent to, and is not okay for an adult to do to a child. So that person is in the wrong, and in giving them more explanation and more options than I deserved it. I caused this. In vivo mastery essentially just means when kids have gone through trauma? Well, I'm curious, I'm gonna pull up participants just to see like hands and stuff like that. Who here has had a kid who's gone through trauma and you've noticed they stopped going to soccer, they stopped doing things that they like to do, they really just seem like their world has shrunk, like it's a pretty small world now, they don't even want to leave the house? People who have seen that, I'm seeing some nods, some hands. Yeah. So in vivo mastery, it makes sense because with PTSD and PTSD like symptoms, it's saying everything's scary, everything's dangerous, so it gets you smaller, smaller, smaller world. In vivo mastery is saying, what are the things that you don't do anymore that are objectively safe? Let's make what we call a fear ladder. What's maybe a 2 out of 10 that's kind of scary. So not too scary, but does cause a little bit of distress. What's a 5 out of 10? What's a 10 out of 10? We're going to make that ladder and we're going to start accomplishing those things. We're going to start with like the 2s and the 3s. We're not going to jump to the 10, but maybe it's like raising my hand in class. Maybe it's staying in class for 10 minutes versus 5. And so it's starting to do things outside of therapy so they can start approaching situations. You also have in TIS the like more joint sessions between child and parent, because it's so important. And this goes actually back to the PCIT, using those types of skills to listen, especially the CDI. What is your child telling me? What is my child telling me? You can also use these skills if they're talking to you about this. But essentially here, it's getting at listening and validating the kid and not dismissing them. Oftentimes, we've seen, unfortunately, with trauma, it might happen within the family, within a family system or within a community. And so parents might be like, oh my gosh, like, I do not want to believe this. Like, this is horrible. Like, how did I not know? And also, this just can't happen because I've trusted this person for so long. And so it is saying, hey, you need to put that aside and use the skills to listen to your kid and believe them when they tell you what's happening. And having a conversation and opening up a dialogue so kids know, hey, parents are listening to me. Just back with the CDI, with the imitation, the labeled praise, it's saying I'm listening and I'm opening this line of communication. I'm not cutting it, like closing the door on that. The last part of this is enhancing safety and future development. So essentially it's, we have had kids who are at risk for self-harm and things like that. Or maybe they've done have impulsive behaviors. So it's how can we keep kids safe in those types of things? But also, what if the community is dangerous? Like, what if somebody in their world is dangerous? How do we keep them safe? What do we do to make sure kid is safe? And also, how do we get you to your future goals? Things like that. So that is the structure of TSCBT. That's prac and TIS. I want to, in the next slide, I'm going to teach you all how you can kind of use some of the parenting skills if you have a kid coming up to you, and answer a couple of questions that came up in the registration. But questions now or thoughts now about TSCBT, and definitely I'm going to actually want to pull up chat. I see a lot of Seattle. Okay. Any questions that comes up? Vivo. Essentially, Vivo, I believe it's Latin based, but essentially it's like live, like in life, like it is like it's really getting at, there's different types of exposures you can do generally in therapy. One of them is in vivo, another is imaginal, which I won't even really dive into much, but there's different types. In vivo means you're doing something out in your world. You're doing things like outside of the therapy session, and not just like, it could be out in the market, it could be out in school, that type of thing. Questions though? Thoughts or questions about this? I'll definitely send resources based off of where you all are located for therapists who are trained in TFCBT, and ones that don't take insurance. So I know that's a barrier.
I have a question, Deanna.
Yeah, absolutely.
Is this something that we can say, hey, I don't feel comfortable engaging in this? It might reflect a personal trauma. So is there a way to kind of refer the child or the incident to somebody else in the organization, or how does that work?
So I do not recommend you doing TSCBT if you are not trained in it as a therapist. This is more so you know what I would recommend as a gold standard for trauma care. What we've seen is the one that makes the most movement and help for those who are 3 to 18 years old. So absolutely, I'm going to send you resources, but there are ways that you can talk to parents and say, hey, I've noticed this thing, or your kid came to me and brought up X, Y, and Z. What have you noticed? So make sure it's a dialogue. They're not feeling like they're being attacked. And hear what parents can say. And you can say, I know of this thing that research has shown can be really helpful with, and give examples. you know, Susie is not doing work, Susie, whatever. This, it's called TFCBT. Here are, and I will send you also resources. Here's places you can go and you can refer to so they can go get that therapy. Yeah, Maria, I think, do you have another question, Maria?
No, I just muted it because there's a TV in here.
Oh,
Sorry.
That's okay. Great question. Okay. There are ways, though, that you can use the parenting skills pieces, and I'm going to talk about that right now, if you know a kid is going through something and maybe is going through TFCBT, or ways that you can really just be there for them within a classroom setting, within kind of like a community setting. So first off, you want to understand the child's behavior in the context of the trauma. So instead of saying things like, you know, Tony is not coming to class, Tony's not turning homework, Tony is just like being really disruptive and it's just super frustrating. Like, what is wrong with Tony? And really putting like the onus on Tony and saying like, their behavior is wrong. What they're doing is wrong. It could be something like, you know, maybe there's a hard kind of family life or something's going on. It can be like, really asking yourself, is this child behaving, is this child bad, which is really what we're getting at when we're using those types of, that type of language, or is he behaving like a child who's had something bad happen to him? Is he processing and trying to deal as best as he possibly can? When you have a classroom full of kids, or you're working in a community of a bunch of kids, different ages, they've gone through different things, and you're not taking care of yourself too, it can be really easy to automatically go to, even if you feel like you're not going to be, gosh, like, why is he behaving so badly? What's wrong with him? What's going on? When you're frustrated and when you don't have a lot of time and probably not a lot of resources, I can imagine. And so really making sure you're pausing and you're allowing yourself a breath and saying, hey, what's the context here? What's going on? Maybe you are aware that they are struggling really financially, or maybe that, you know, dad did something and is now unfortunately, you know, going through a legal battle, and might be imprisoned. Maybe, you know, Tony comes and tells you, or you overhear a conversation of like, yeah, you know, like this teacher touched me in a way that I did not, like, I didn't say yes, like, I did not consent. And also teacher should not be doing that. But like, you hear these types of conversations, it's putting into context and saying, hey, instead of leaping to they're a bad kid, or they're just behaving because they're teenagers like this, or because they're kids, what else might be going on? What else is the context here? And that allows you to first take a pause and take a breath. Because again, I'm sure you all have a lot going on, you know, within your classrooms and your settings. The next thing is, we're getting back to praise. We will tell parents, and so this is a way that you all can do it in one-on-one settings and you know, settings in your school, praising. I think people think you're often praising kids and teens, but in reality, they're probably actually more so criticizing and saying, going to those negative things of don't do this, don't do X, Y, and Z. And so what you really want them to do is, if they're exhibiting and you know they're going through trauma care or they've gone through a trauma, if they're exhibiting like not doing homework, maybe being disruptive, throwing things, destructive behaviors, bring back that labeled praise. Be specific when they do something that's a desirable behavior, something that's going to help them and something you want to see. So praises like good and nice work are really not that helpful. Like we've talked about, they're really vague. So instead, doing things like, you turned in your homework, that's great. Even if it's late, you turned in your homework, awesome, love that. You know, you sat through class, you know, and didn't throw something at your friend, awesome. I really like seeing that. Being very specific, again, this is going back to the things we talked about earlier, we practiced earlier, using specific labeled praise. Because you can imagine a kid who's gone through trauma is probably, and exhibiting these behaviors, is probably already getting a lot of, why are you doing this thing? Can't you do this thing better? Why are you staying out late? Why are you skipping school? Why are you yelling at me? Don't do these things. Don't. And so for you to be a change for them and be like, hey, I love that you did that. Nice job doing this specific thing. That's massive for them. That is going to be a game changer for them, because it's like, oh, okay, that wasn't the behavior, like that's not what I'm expecting to hear from people who are like in a higher level of power. That's awesome. And then it'll help teach them more so about desirable behaviors. You also want to be really consistent. Don't just offer it once. Be more consistent. Anytime you see something, even the smallest thing, praise. Labeled specific praise. Also avoiding complicated praises with like the negative add-ons. So you did a great job getting your homework done before dinner or before this, like it was due. Why can't you do more of that? that's just negating the whole thing you praise them for. And so they're only focus on that, the recency effect. They're gonna focus on that last bit. Really enthusiastic, but also I think culturally and contextually, what makes sense and what works for a student, for a kid. If they're from a culture or a background where you labeling on like a lot of the warm, hot praise is kind of like, ooh, this is like feels too much, then you need to figure out ways to kind of cool it off a bit, but still give that directed praise. What you're then going to do is take this praise and you're going to couple it with what we call active ignoring in TFCBT, or some other people might have heard like differential attention, essentially. This is where keep praising the things you want to see, and you're going to ignore, as hard as it is, you're going to ignore the behaviors that you don't want to see. So you're not going to give attention, because you giving attention like, oh, don't be late for class. Don't throw that thing at your friend. Don't talk back to me. You are acknowledging the behavior that they're exhibiting. And even if you're saying don't, what do we say when I say don't think about a pink elephant above my head? They're gonna think about it. They're gonna think about it. So you still giving them that attention is reinforcing that behavior to happen again. And so in the classroom setting, in community settings, ignoring that bad behavior and only finding that kernel of truth of like what is like what you want in terms of praising, you praise that. Even if it feels like there's so many other things that are going wrong, you find the thing that you can praise and you ignore the rest. So don't, I'm telling you don't, but avoid responding to the child during the behavior that you don't want to see and immediately after it occurs. So just because you ignored it when it was happening doesn't mean right when it's done, you go late in and say, don't do that thing. That is still reinforcing it. You're actively ignoring verbal or emotional reactions, those types of things. You don't want to ignore those dangerous behaviors. I'm not saying like if a kid is exhibiting self-harm, if a kid is, threatening something, to hurt somebody else, obviously those are the types of behaviors you still want to address in a way that is not reinforcing. So not necessarily being super warm, but being more neutral. What's going on? Talk to me a bit more. Help me understand what's happening here. Because we see that if you're too warm when people exhibit behaviors like self-harm, which is something we have a tendency that we want to do because we want to be like, you're okay, I'm going to take care of you. It could teach the kid, oh, if I self-harm, they'll pay attention to me. Instead, you want to say, hey, I'm not ignoring this and I'm going to be more neutral. And then when you do something like, hey, instead of self-harming, I'm going to go distract myself by like playing soccer. Awesome, that's amazing. Then you jump in with the warmth and the praise there of that specific praise. So again, you're not ignoring those unsafe behaviors, but you're also not treating it in a way that we're not going to reinforce. We're also going to try to ignore like people being super sassy and defiant. And again, the moment you see something to praise, you go in and the differential attention, you ignore the other stuff. It's hard when you're in a classroom. It's hard when you have all these other things happening around you. And it's like a muscle that you have to practice. It's not going to happen overnight. It's something that you can try to slowly build into your practices in the classroom, the community setting, that then you can build that muscle up. If you've ever played an instrument or sport, you have to practice a lot before you get to being really, really strong at it.
Diana, can I interrupt for just a second? There's a great point in the chat. This might be a good moment to address that. What do you do when you're trying to ignore a behavior that isn't desired, but you've got other children coming to you and reporting the behavior? How would you recommend responding to that?
Yeah. And you're saying when I'm just reading the chat, especially when the other kids in the class is telling you about got it. Well, you can first off tell the other kid like, hey, thank you for telling me this. I'm aware, letting them know I'm aware of the situation and I'm doing what I can to handle it. And also I'm going to get to it. Hopefully I'm keeping that in time. Modeling is super, super important. So you actually labeling out loud in front of the class, the desired behavior for a variety of students. Don't just focus on the one kid. That is modeling to students, to other kids. Hey, this is what we're going to be doing. I'm going to be picking out these behaviors that we want to see. And they pick up on these things. They might not know it exactly like in the words that we're using it, but they see a lot more and they take in a lot more than what we think they are. And so I'm just reading the other ones. Yeah. So I would say, first off, acknowledge like, thanks for bringing this to me. I'm aware, to try and just say, hey, I got it, and then leave it as is. And then doing your best to model out loud to everyone else, not just one-on-one with the kid, but to everyone labeled praise. So you can see then the kids are going to start to want that labeled praise and they're going to do more desired behaviors. And then you're going to see over time, less of the undesirable. Yeah, Jenny.
Would it be an effective approach in this type of scenario to be like really transparent with the children about the approach you're taking? Like, or would that be conflicting with the approach?
Yeah, I think depending on the age, I think it's fine. Some kids might not quite understand what you're saying specifically, even if you don't use the words differential attention. But I'm pretty transparent with my clients, like one-on-one. I will tell my teens or kids, I will say, hey, I know you're doing the thing, I'm noticing it, and I'm not going to give it any attention going forward. Like, I'm not going to pay attention to this. And so you might see it just like temper tantrums. You might see an increase in that behavior. You got to stick with it. Stay strong, because then it will go down later on if you do not give it attention. So depending on their age, yes, you know, a 5-year-old might not quite understand what you're saying when you say something like that. But, you know, a 13-year-old, a 12-year-old, an 11-year-old, yeah, or higher, they will understand that. A decision. Yeah. Yep, exactly. That's really nice. I think that's Melody, maybe, or maybe not. No, I'm not sure who that one is, but the GA, I'm not sure if that's is it Kaward? Is that your first name? I apologize if I'm not saying that right. Grace. Okay, Grace, thank you. Exactly. That's a nice example. The other thing, practice with each other. So just like we role played, it is so important because we might say, oh, these all sound really easy to do. I can do this. Add in 10 kids, add in variety of different things that you're just going on. It's actually not as easy as it seems. And so if you have team meetings where you can practice these types of things, role play, be a challenging kid, be the one who's disruptive, because it can really help the other people practice and start to build up this muscle in situations where you can say, pause, let's talk about this. How did it go? Let's try it again. So that when you go out into the actual arena with your classrooms or your community settings, you know, you can really feel like you have more practice under your belt. I want to address
Diane, another thing you can do is when you have recall time, you can mention it then and say, I remember I noticed that a lot of you had concerns about something that happened in our classroom with one of your friends. Let's recall and let's talk about that and have a group discussion about it.
Yeah.
You know, it may not happen then because you're trying to get through with whatever, right? But again, that to me is a good time to follow the children's lead.
Yeah.
You know, because maybe the story you're reading is not what they want to hear at that time. Somebody's communicating something different, right?
Yeah, that is true. And so something that's important about that piece is with the praise, do it immediately. Praise given later on, the positive reinforcement later on, is not going to be very effective as if you do it right in the moment. However, having those conversations or saying, hey, we are not going to give attention to X, Y, and Z because of A, B, and C. That can happen later on. Sure, like it'd be great if it could happen in the moment, but maybe you're trying to get kids to the next room or get kids to the next thing, get them on the bus. It can be something you revisit and it'll still be impactful. But the praise piece, as much as you can right after you see it happening, because that's when we see the biggest increase in the behavior. Okay, I might speed through a couple more things, but we had a couple questions here. So how to support a child who's using play with other children to act out an assault, whether it be a sexual assault, physical assault, something that happened to them. My thoughts here are the moment you see that, redirect as best as you can, because we really want that play to be happening with somebody who's a professional, somebody who is skilled in that area where they can give them the labeled praise, who also maybe understands, who has the understanding of what happened or what may happen based off of what they're saying. Other kids might not understand and they might just be very confused as to what's going on. So coming in and redirecting as best as you possibly can, which I feel like teachers are so good at, and at the same time, having time with that other kid, the kid who's gone through the assault, to reinforce, hey, I really think it's great you are talking about this and wanting to express what's going on. And having the resources say, and I really think it'd be helpful for you to talk to blah, blah, blah. Or I would love to talk with you later, and bring in like the counselor who might be trained in this a bit more so that they can have that time, because they need that space. And you want to reinforce, you want to shut it down, like, don't do that. Instead, redirect and be like, hey, it's time to clean up, or hey, we got to go move on to this other thing. Then having that time with the kid and say, hey, that was awesome what you're doing. I love that you're talking about the issues that are happening, because it's important to talk about the emotions. It's important to hear what's going on with you. And let's talk about it with me, or talk about it with counselor, those types of things. you really want to get the kid then to something like TFCBT or another evidence-based trauma focused therapy. Again, for me, TFCBT is the gold standard. And again, I'm going to take those locations and try to find resources for you all in your areas. A similar question, but how do you support a parent and child who are both survivors of sexual assault? So this goes back to, because there was a piece to this question that I didn't put in here, but it was about play. Like, if they're using play to act out what's going on. Well, the big thing here is we do not want a kid who has been sexually assaulted to act out play with another adult, because especially if there's a perpetrator still involved, because what we're saying in those situations is, essentially what we're saying here is, if the child has already been in a compromising situation or is in danger of being like manipulated again by an adult, being assaulted again by an adult, we don't want them to build this relationship where they're acting out what happened with somebody who has already compromised what's going on with them, who has been a part of it, or who could be a figure of being manipulating them. We don't want to see that happening, because they have already been, they're violated. And then if you're allowing them to do play with this person, or in a situation even with their parent who has been sexually assaulted, if they have not gotten treatment yet, that is just teaching the child more to listen to adults that might not be safe, to be in a situation where it's okay, to listen to them and do things that they don't actually want to do. So again, I default going back to, if you know this is happening, getting the child into a type of therapy that is evidence-based, like TFCBT, is the gold standard of what you can do. I know it's not necessarily easy, because resources, it's hard to come by. And this is kind of really what you want, the gold standard, the thing that you want to get the kid to, because again, we don't want there to be a mixed signal of who they're talking to and who they're acting these things out with, because they might be a compromising person. You can imagine that even if the parent who's been sexually assaulted themselves, they might have negative beliefs about the situation too, that may inadvertently be transferred to the kid. They may reinforce those yeah, the world is really scary, you shouldn't go anywhere. Those types of things. So you really want to make sure it's a professional who's been trained in these types of situations who can help with the kid. I do have more things to talk about, but I'm recognizing we're at 29. I'm wondering if it would be okay. People can drop off, but Becky, would it be all right to keep going for another 5-10 minutes?
Absolutely. Anyone who's able to stay on, please do so. We're also going to send the recording of this workshop out afterwards. So if you do need to hop off the call, you will have access to anything that you might miss after 12:30. Thanks, Diana.
Yeah, absolutely. Okay. I'm going to kind of try to get through the rest, and then I'll take questions for anyone who's able to stay. So we're going to move on to restructuring, which I think there's an important part here that is tied to trauma as well. There's that coping, the cognitive coping, that is part of restructuring, but restructuring can also be super important and helpful in other situations. Those who have ADHD, those who have depression, anxiety, all sorts of situations, low self-esteem. And so that's why I wanted to dive into cognitive restructuring a bit more. So cognitive restructuring, it's essentially what you're doing is you're identifying ineffective, unhelpful patterns of thinking, and you're working to change them to be more effective, more helpful. Going back to that cognitive, the CBT triangle, if we're able to work on the thoughts and change the thoughts, that might help with the emotions and then also the behaviors, or the direct behaviors and also the emotions. So when we say what is more effective, helpful, that's kind of vague. It could mean cueing less negative emotions. It could be seeing things like you are helping the child or teen see a situation in a different way, adding more angles onto what's happening. I'll give you an example in a bit of that. Or using just more skillful behavior. Really important. Cognitive restructuring is not just positive thinking. Oh, I think that's one of my biggest pet peeves. It is not just turning things and spinning it in a positive way. Things might actually be really tough. And to say something in a more positive way could be really invalidating to the kid or to the teen, because it could be really tough. It could be really challenging what they're going through. So it is not just reframing things in a more positive way. Oh, well, you're going to be okay because you can just tough it out. Everything's going to be fine. Things happen for a reason. Oof. Those things just make me cringe when I hear those types of things, because it can be really invalidating for the kid. I'm going to walk you through how you can do this, though, in a way that's not going to be just restating into a positive way. So steps of cognitive restructuring, you want to identify the situation that cued or triggered those negative thoughts and feelings. And what you're going to do, and I'm going to give to Becky some handouts that you can practice this on, but you will record that situation. And what you're going to do is also record all the components, including all the thoughts that came along with it. Meaning, what are your feelings? So that's both the physical sensations and also emotions, if they can label it. What are the behaviors that you either wanted to do, like had an urge to do, or actually did? And what are all the thoughts that came up along with the situation? Maybe a kid didn't do well in class. They didn't do well on a test. I'm stupid. I'm failing. I'm never going to go far in life. It's all my fault. My parents are going to hate me. All of them. You want to write them all down. Then you're going to pick one of those thoughts from the list that you created. And it could be really what you're trying to get at is the one that feels like the most responsible to lead to like those negative emotions, maybe of shame, guilt, anger, sadness. And what you're going to do is develop different points of view about the situation. You're going to take that thought and say, hey, let's break it down and say, what else is going on in this situation that could be plausible? What are some other scenarios? And then we can use questions, and I'll talk about that in a little bit, to help you get at different angles there. And so after that, you're going to craft essentially a different thought. That different thought will lead to different emotions and different behaviors, or different behaviors and different emotions. So I just want to I want to do a quick little show of just like what I'm going to send you. These are all different ways that you can kind of break those down, where you're asking yourself, what's the situation? What is the thought that came up that's not super helpful? What feelings did I have and what thoughts did I have? And then on the thermometer, like the emotion thermometer, where was I? What emotions came up for me? And then what did I do? And then you're going to change it. Like, okay, what are different ways of thinking about this? And I'll give you an example in a couple minutes. How did this change the feelings that I had associated with it? What's my new feeling level? And what am I now going to do? This is just another way that's probably for those who are teens. It's just, again, talking about situations, feelings, the thoughts, the challenges that go with it, the new thoughts and the new feelings. There are different ways you can do this, and I'll be sending these handouts to you all. This is another, again, you're going to use the triangle to help them kind of figure out what's going on, what's the situation. There's so many different ways you can do this. And then again, marking down what are the new thoughts, what are the new feelings, what are the new actions. The big thing here, though, I'm going to send these worksheets, and you can find them online. There's plenty of different examples. I don't want you to get caught up in the worksheets. Use them to practice. Use them to help you get better, like at cognitive restructuring. I'm going to give you an example in a second. But then you're not going to need them. It's not about the worksheets. It's about gaining the skill of cognitive restructuring so that in the classroom, maybe you're hearing a theme of they all think they're stupid because they didn't do well on the test. Let's come up with some alternative solutions. You don't have to say, I'm going to do cognitive restructuring. You can say, hey, I'm hearing a lot of talk about you all think like you're going to fail. You're not going to go far in life. Let's talk about this. Maybe I made the test really hard. I need to go back and look. That's a possible situation. You all had a lot of other things going on. I know you had a math test, you had a geography test, and you also had parent-teacher conferences coming up. My gosh, you're probably all really stressed. And you had a lot to work on that week. Coming up with these other situations and then helping them see like, if I thought that way, I'd probably feel like a little bit better then about, less anxious about the grade that I got, about the situation. And this might lead me to want to talk to the teacher, ask for maybe some extra credit, ask for tutoring, that type of thing. You can do it in a group setting. You can do it one-on-one. You could do it in small settings. You don't need to whip out the worksheets. It's just the worksheets can help you practice and get better at cognitive restructuring so that then you can actually do this in a group or on a one-on-one setting on the fly. So again, one-on-one setting, group class setting, super helpful we've seen in research with ADHD, anxiety, depression, low confidence, low self-esteem, those types of things. Given time, we're not going to do a practice, but I do want to, I'm going to stop sharing this one, but let me go to, close out the chat. I'm going to be sending this all to you, but here's an example. So this is a very common one I think you can see in kids and teens. You had a friend hasn't spoken to you or to the kid as much as they usually do. I know I've gone through this situation as an adult and it feels like, gosh, what's going on? And some thoughts that might not automatically come up is like, gosh, my friend hasn't talked to me. She must be mad at me, or she hates me. She doesn't want to be friends with me. These kind of more automatic thoughts. Leads to feeling really sad, feeling really hurt. And so then because of that, well, then I ignored Emma. I didn't talk to my friend because like, well, she's mad at me, so I'm just going to ignore her and avoid the situation. And that's probably going to spiral into them not talking to each other even more. So what are some new thoughts? It could be that Emma is upset. You don't know. You're not going to know necessarily. And so maybe this leads to more about concern, and asking Emma then, like, what's wrong? Like, are you mad at me? Like, what happened? It could be, which is probably one of the more common ones, Emma's really stressed and busy at school. Things are going on. And so feeling like then changes to, oh gosh, I feel sad and disappointed I haven't been able to talk to her. And also more understanding and like, goodness, like I'm worried about her. I care about her. And staying friendly, still engaging, not avoiding and just making the situation a mountain out of a molehill. And maybe Emma is upset about something that's totally unrelated to you. And so now the feelings are, well, I'm worried about how Emma's feeling here. And so then I'm going to ask her what's going on and if she needs help. And again, I'm going to share this all with you. Let's go back to this. What you can see there, though, when you're doing that, you're coming up with all these different situations that have different feelings and different, probably more helpful behaviors. And so if you're able to coach and help kids do that on the fly, one-on-one, in a group setting, it can be really helpful for them, one, to gain self-confidence, and two, decrease those worry thoughts, decrease the anxiety, decrease the depression. Oftentimes what we'll see too when we do cognitive restructuring, it's kind of like an experiment. They might have to test out, let's test out and see if Emma is upset about something totally unrelated. Well, maybe it is that Emma's just stressed. So you didn't get the situation totally right, but at least you were engaging and trying to get more information. Ending really quickly on the benefits of modeling. Essentially, modeling, as we know, really it's about the heart of it here is kids and teens see and do and watch what you do and like learn from you way more than we actually think they are. They will see you doing that thing that you think nobody else saw. They will see you roll your eyes, even though you thought you were looking away. Those types of things. And so being aware of that and saying, how can if I want these kids to do X, Y, and Z, show up on time, turn in homework, talk to me when they're upset. Well, I need to be able to model those behaviors to them and make sure they know this isn't actually a safe space to talk to me, to be open. And so really the heart of this is taking modeling throughout all of the other techniques we've talked about. If you're going to actually want them to do something, it's kind of the practice what you preach thing. Actually model it for them. Show them how this can be really helpful. I apologize that we had to run through this. So any questions? I will stick around for questions. I also have my contact information if anyone wants to reach out about other questions. I'm going to kind of craft over the weekend based off of the places you're at. Resources, especially for TSCBT, and just more about PCIT as well. And I'll send you those handouts that I was showing on my screen, so you can practice cognitive restructuring. I highly recommend if you have a team, practice with each other, because cognitive restructuring can feel clunky at first. But if you're able to practice it with really easy examples at first with each other, you're going to be able to just whip it out on the fly versus having to be like, here's my worksheet. Hold on, let's write all this out. Whew, okay, I'm going to stop sharing and see if there are any questions, comments. Yeah. And also if you need to head out, totally understand that as well.
Diana, thank you so much for this incredible workshop. While people are thinking of their questions, or if anyone does need to hop off, we understand it's past time. We really appreciate you sticking around and being here again on a Saturday with us. I'm just going to drop something here in the chat. We have one more Institute workshop left in 2022, and it is next Saturday with Stephanie Courtney, Black Maternal Health, looking at change through art. It is December, it's the holiday season, so we're noticing attendance is kind of dropping this month. If you could please share this event with your networks, it's going to be an incredible workshop. We would love to see more folks signing up to attend, especially folks working with infants and birthing families. So please do consider coming and sharing that with folks you know. And we are actively looking for presenters for 2023 for our winter spring series. So please do get in touch with me at the Institute email address. And I'm just going to type that in the chat there. if you or someone you know would be a great candidate as one of our workshop leaders. So thank you again for coming, and Diana and I will stay on a few more minutes if anyone has questions.
I'm just trying to catch
Just want to
so
say
much in
thank
chat.
you.
Yeah.
Thanks for being here, Tony.
Thanks for having me.
Yeah.
Person, I think that I don't know if they're still on, but do you think this helps with children who are experiencing extreme behaviors, but not specifically reacting to a known trauma? When you say this, do you mean TFCBT or cognitive restructuring? I think that was HLREMUND.
Mhm.
Well, I can say for TFCBT, it's definitely something more targeted for those who have gone through trauma. And at the same time, those who for extreme behavior, I'd love to know more about what extreme behavior means. There's something we did not talk about, although I think there was a workshop on. When you say extreme behaviors, my first thought, because I also do DBT, is like things like self-harming, a lot of self-harming, maybe suicidal thoughts, ideation, substance use, those types of things. My first thought actually goes to like DBT. And if they need a higher level of care, doing something like dialectical behavior therapy or finding like those resources, which I think there was another workshop on. And at the same time, a lot of these principles can still help you with kids who are exhibiting those extreme behaviors, trying to understand where this extreme behavior is coming from. A lot of times we don't even ask kids, why are you doing what you're doing? What's going on? What's the emotion? What are the thoughts? And so if you're able to get a little bit more of that and use these principles to help you reinforce them actually talking to you and that type of stuff, that can open up a whole window of you understanding more so and help direct resources a bit more for being able to help them. So whether it be like DBT if it's really high level of kind of behavior, or TFCBT if it's trauma. So like hitting or kicking the walls, throwing objects like chairs or materials, and like got it. Yes, these all, I would say cognitive restructuring is probably not the first place I go to for those types of things. TFCBT, if there's trauma involved, yes. But things like in terms of those behaviors, I'd actually turn towards another type of CBT because we couldn't talk about everything. If you're able to get parents involved, that could actually be really helpful, or a caregiver, a guardian, a brother, a sister who might be older, aunt, grandparent, and do what we call parent-child training. Because a lot of times you won't have enough time with a kid one-on-one in school to be able to help, like be able to do enough where that's going to totally change when they go home. They're going to be spending, yes, a lot of time with you. And so you can be structured, you can be labeling things that they do well, that type of stuff. And if you can get parents or caregivers, guardians involved as well to do it at home when there's less of a structure, that can be really, really helpful as well. And if I remember, let me write that down to try and see if there's other parent-child resources for that. I think the child more info about unsafe behaviors that you can't really ignore and not responding to redirection. So I would say unsafe behaviors means like cutting, self-harming in various ways. It means like threatening, like hurting another child or another person. It's talking about using guns or other weapons to hurt people. It's talking about suicide and having suicidal ideation, so those unsafe for others and for themselves type behaviors. Those you definitely want to address. Finding a time to talk with them one-on-one, using the skills of listening, of praising when they are being open with you and talking to you about things, and telling them, gosh, that must be really hard what you're going through. Like clearly there's a lot, to get more of an understanding. You don't want to ignore those behaviors because one, somebody else could get hurt or they could get hurt. And at the same time, that to me is describing a higher level of care. And so again, going back to something like dialectical behavior therapy, getting the counselors involved, if you have counselors, those types of things, creating a safety plan. And in a way, what I was getting at with the warmth there is you don't want to reinforce that if they're going to tell you, I want to kill myself, you're going to respond with warmth and like, oh my gosh, I'm so worried about you. You're going to be okay. And a lot of reassurance, because that might teach them to, if they need help, they have to use things like I'm going to kill myself or I'm going to hurt somebody else to get that like help. You want to teach them, you ask me for help, just like I need help, I'm going to be there. I'm going to be there for you. I want to listen. I want to help. And then when they tell you about the other stuff, you just want to be more neutral. Like, okay, tell me what's happening. Tell me more about the emotions. What's like, do you have access to things, you know, assessing for like means and whatnot. And then when they start to do things like tell you like, I need help, that's when you like really give lots of praise and really jump in with a lot of warmth there. There's a difference between a kid throwing maybe a piece of paper at a friend versus a kid saying, I'm going to cut myself or something, you know, those are the types of things. Mm-hmm. Okay, for toddlers, goodness, I would say, again, differential attention is really helpful there. Like the specific, like paying attention and praising what you like and what you don't like, or praising what you like and ignoring what you don't like. For that though, too, it's going to be also possibly bringing in more aid if you need it and if you have the resources, because I can imagine if you have a bunch of toddlers running around, it's going to be really hard to keep your eye on just one. And so if you're able to bring in another teacher, even for a little bit, where you can work one-on-one with the kid and then have the other teacher kind of watch the rest of them, just getting a little bit more of that directive kind of attention can be really helpful in those situations. It also depends on what's going on with the kid. Is ASD involved? There are other things to bring in if there's like an autism diagnosis, those types of things. There might be just a higher level of care there too, unfortunately. Mm-hmm. Okay. All right. I think that's all the time I have. I hope that was helpful. I wish we could have like hours and hours to talk about this.
That was amazing, Diana. And I love how even though it in some ways it feels like we just scratched the surface, you also gave us such an incredible depth of resources and ideas of way to integrate this practice now into our programs and our interactions. And what's really sitting with me is I think that I've over the years I've fallen into that camp of like, don't use praise, it's just dangling, go with encouragement instead. And I've been kind of like anti-praise. And I think the workshop today has really challenged me to rethink that and think about both and instead of either or.
Yeah.
And the power of praise, especially when there are more challenging or intense behaviors, how that really can help a child restructure their brain and their actions.
Yeah.
So thank you for that challenge and for encouraging us to really expand our thinking around how that can be an effective tool.
Yeah, absolutely. It was a pleasure. I'm so grateful to have been invited and had a wonderful time, and wish we had more hours to chat and to talk about more things. And so I'll definitely work on crafting those like more curated resources, and I'll send them to you, Becky, so that everyone can have access to those.
Wonderful. Wonderful. Thank you. Thank you, H. Thank you, Caitlin, for staying on with us. Hope you have a great rest of your weekend. And we'll be sending you those resources very soon. Thanks, Diana.
Thank you. Bye.
Take care, everybody. Bye-bye.